Hey there, Elizabeth Scala here from elizabethscala.com. Today I'm going to talk about something that we do in nursing. I do it myself. I've been in committees and groups that do it as well. And this is called the problem-solving approach. So we have a problem, we gather as a group, whether in a council, committee, staff meeting. We look at the problem and then we look to come up with a solution. Okay, sounds reasonable. Sometimes we'll look at benchmarking, we'll compare ourselves to other departments, other specialties, other organizations that are similar to ours, looking at percentages and scores. Sometimes we'll look at the past in terms of this particular problem and say to ourselves, how did we fix this before? Again, these things are quite normal. They are practical, and often they do serve a purpose in terms of getting to an outcome. While this is well and good, it also does not really, it sort of limits us, okay? What we focus on, and you can learn more about these concepts in my book, Nursing from Within. What we focus on, we give energy to. What we pay attention to, we see more of. So only looking at the problem and expecting to find a solution is limiting. What we need to do is really focus on the solution, which sounds counterintuitive, especially if we don't know what that solution is. But hear me out for a second. What we can do is look towards the vision of what we want the outcome to look like. Let's say we're struggling with a communication issue. We are having ancillary staff bring up supplies from a central store location, and we're not getting those in a timely fashion. So typically we want to look at that problem and come up with a solution in terms of how can we get the supplies more quickly. What we want to do instead, and what I encourage you to kind of think outside the box to do, is look at the end result. What is the ideal? What would it look like if that problem has gone away? What is the vision for what you want to have happening? Okay, start to paint that picture of what you're moving towards. Now, this again, it sounds different, it sounds counterintuitive, and it sounds kind of challenging, like how are we actually going to solve this problem? What starts to happen is, as you think creatively in this way, as you vision out the solution and the outcome of what you want to see, action steps start to come to mind. The creative juices start to flow and ideas spring up on how to actually solve this problem. The steps that you need to take to get to that ideal outcome that you've created. So problem solving goes on in nursing. Meetings happen where we talk and talk and talk and talk more about our challenges. I want to encourage you today to offer this new way to your nursing groups, to your teams, to the committees and councils that you're on. Say to them, hey, you know, I've heard of this sort of visioning exercise where we look at what is the ideal? What will it look like when this problem has gone away and we're functioning in our ideal setting? And then see if you can take the group through the exercise this way. So if you'd like to expand upon this further, as I said, I go through this in my book, Nursing from Within. You can also visit elizabethscala.com for more support, resources, and actually blog posts that go a lot more into detail on these concepts. Thanks for watching and enjoy the day. Thank you.